Parkinson's disease is a chronic neurodegenerative disease with a slow but progressive evolution that affects the central nervous system. The main pathological characteristic of Parkinson's is the degeneration of the neurons responsible for the production of dopamine in a particular area of the brain, called the substantia nigra, responsible for the execution of many motor functions. Parkinson's disease, which takes its name from the English doctor James Parkinson, who was the first to describe the symptoms, is the second most widespread neurodegenerative disease in the world, immediately after Alzheimer's disease. Parkinson's disease can affect people of any age, but its incidence increases significantly as the years pass. It is no coincidence that it affects approximately 1% of the population over 60 years of age and 3 to 5% over 85 years of age, with an incidence in men 1.5 to 2 times higher than in women. But what are the most common initial signs and symptoms of Parkinson's disease? Let's go see them. Resting tremors. Tremors are involuntary, oscillatory, and rhythmic muscle movements due to the rapid alternation of contraction and relaxation of the affected muscles. In patients with Parkinson's disease, tremors are often the first motor symptoms of the disease, particularly at rest, that is, when the limbs are still or when the patient is sitting or lying in bed. Parkinsonian tremor most frequently affects the upper limbs, in particular the hands, where so-called pill rolling can be observed. This metaphor describes the tremor that occurs with the involuntary rubbing of the thumb on the index finger, which recalls the image of preparing pills or counting coins. In Parkinson's disease, tremors generally tend to decrease or disappear with the execution of a voluntary movement. However, action tremors can also occur in some people, that is, when a part of the body is moved voluntarily to perform specific activities, for example, when grabbing a glass of water or a pen to sign a document. The tremor associated with Parkinson's, as well as the upper limbs, can also affect other body areas, such as the jaw, lips, tongue, and chin, with important repercussions on chewing and swallowing, facial expression, and phonation. As the disease progresses, this symptom worsens until it reaches its extreme form, defined by the term Parkinson's mask. This is because the facial muscles that control expression no longer move properly, preventing the face from expressing the person's emotions and feelings, just as if one were wearing a mask. Data from functional neuroimaging studies indicate that the onset of tremors is due to dopaminergic dysfunction in the globus pallidus, a subcortical structure of the brain involved in the regulation of voluntary movement and in balancing the excitatory action of the cerebellum, as well as a dysfunction in the cerebellothalamo-cortical circuit, an important system of brain connections. Bradykinesia. The term bradykinesia indicates a neurological movement disorder in which one has difficulty initiating a new body movement. When you try to do so, you will observe a significant slowdown in its execution. This disorder usually has a gradual onset and tends to appear already in the initial stages of Parkinson's disease. This slowness of movement inevitably limits the performance of the simplest daily actions, such as getting up from a chair, eating, getting dressed, and walking. Bradykinesia can also worsen over time, evolving into akinesia, where instead it leads to the loss of the ability to move the muscles voluntarily. This is the case of freezing of gait, a motor block that occurs suddenly in Parkinson's patients, in which they feel their feet are glued to the ground. This disorder not only causes the temporary inability to walk, but also significantly increases the risk of falls. Following a study conducted by researchers at the University of Würzburg in Germany, it was discovered that the phenomenon of gait freezing is due to a temporary loss of connection between the motor cortex and the subthalamic nucleus. In patients suffering from Parkinson's disease, however, the main cause of akinesia seems to be attributed to a dysfunction of the dopaminergic system, in particular in the release of dopamine in the brain, which thus leads to a slowdown of movements. Muscle stiffness. Muscle stiffness occurs when a muscle or group of muscles remains contracted involuntarily for a prolonged period, resulting in a pathological increase in muscle tone. This is one of the hallmarks of Parkinson's disease, along with tremors and bradykinesia. It can occur on one or both sides of the body and can cause pain in the affected muscles or joints, limiting movement and negatively affecting the patient's quality of life, including sleep. Muscle stiffness occurs more frequently in the limbs and trunk flexor muscles, but can also affect the facial muscles, tongue, and larynx. It can be classified into two distinct forms: lead pipe rigidity and cogwheel rigidity. In the first case, there is a uniform sensation of rigidity, in which the muscle offers constant resistance when moved, just as if you were bending a lead pipe. In the second case, however, the rigidity manifests itself in spurts, as the resistance to mobilization occurs intermittently, just like the movement of a cogwheel. Resting tremors, bradykinesia, and muscle rigidity are therefore the most common onset symptoms of Parkinson's disease, whose severity varies from person to person. However, these may also experience other physical and psychological disorders, such as balance and sleep disorders, including insomnia, early and frequent awakenings, and restless leg syndrome, chronic neurological disorder in which there is an uncontrollable need to move the lower limbs. Other possible symptoms of Parkinson's disease include constipation, dysphagia, difficulty swallowing, sialorrhea, excessive saliva production, and bradyphrenia, global slowdown of the various cognitive functions characterized by slow thought processing and difficulty or inability to concentrate. It is good to remember that there are some neurological diseases known by the term Parkinsonisms, which can cause symptoms very similar to those of Parkinson's disease, but which are actually caused by other causes. These include brain injuries or trauma, vascular disorders, medications, or exposure to certain environmental or industrial toxins. In conclusion, although current therapies for Parkinson's disease are generally effective in controlling symptoms, unfortunately, they are not able to stop its progressive development. Continued commitment to scientific research offers hope for future advances, aiming not only to improve existing therapies, but also to better understand the causes of disease and develop new, more advanced therapeutic approaches, but above all, more effective.